The major focus of my research program is dengue. Dengue is a viral infection that's transmitted between humans by mosquitoes. It's a disease of enormous consequence in Asia and Latin America, so it's an enormously prevalent disease for which currently we have no vaccines or specific therapies. I've spent the last decade in Vietnam learning how to do clinical research, how to do clinically focused basic science in terms of preventing dengue transmission in the community.
Cam, working with a group in Vietnam, has made some amazing discoveries about this disease, particularly trying to understand new treatments and understand what puts people at risk.
Our three themes in our research program are firstly to give doctors a set of tools that will enable them to make an early diagnosis of dengue and to enable them to predict which patients may go on to develop severe dengue. Our second major thematic area is to develop and test therapeutics for dengue, to prevent the clinical complications of dengue happening in patients and to shorten and reduce the severity of symptoms of dengue. Our third major thematic area is an entirely novel approach to stopping dengue transmission in endemic areas, and involves introduction of a bacterium called Wolbachia into the mosquito population and prevent the dengue virus from replicating in the mosquito tissues. What we potentially can provide is a major reduction in disease transmission and to take away the enormous disease burden of dengue. What's brought me back to Melbourne is a stage in my career where I'm looking for the next step, and I'm particularly excited about going into the Peter Doherty Institute. I've been to many institutes internationally, and there is none like what the Peter Doherty Institute will look like in a few years' time. Melbourne's recognised across the region in terms of its ability to provide world-class education. What I'm genuinely excited about is the opportunities that my network of collaborations and relationships across Asia and what that can provide in terms of unique training opportunities for Australian young scientists, for clinicians, and indeed for the commercial sector in Victoria.
Having Cameron is absolutely wonderful for several reasons. First, he can inspire other students with his dynamic work that he's doing at the laboratory bench, but also showing how it can be applied in Vietnam.
The VESKI program plays a key role in doing that, and it brings back people who've spent years overseas and have developed sophisticated networks that they can bring back to Australia and allow us to benefit from those networks.
The type of research that Cameron does costs money, and it's important for us to be able to provide facilities for him that would enable him to conduct his research in a sort of unfettered, unimpeded way.
You want that sort of flexible funding to really be able to respond to new opportunities that arise, and they inevitably will, and the VESKI support will be enormously important in taking advantage of those opportunities in the next few years in my transition back to Melbourne.
Because the VESKI Fellowship is ranked very highly, it's highly prestigious, and of course when Cam goes to look for further sources of funding, to have achieved this fellowship indicates his standing in the field.
We're really grateful to the Victorian Government and the VESKI program for the support it gives us in bringing back these superstars.
I think VESKI's support to the university and to other institutes in Victoria enables the institutes to push their profile regionally and globally and reinforce the image of Melbourne as one of the true global centres of excellence for education and research.